Vaccines were the stars of the fight against COVID, but antiviral therapies like Paxlovid were also crucial in the effort, according to Dr. A. Mark Fendrick, professor of medicine and public health at the University of Michigan.
This drug has led to decreased hospitalizations and decreased deaths.
The CDC says a 5-day course of the antiviral medication cuts the risk of hospitalization in half. But changes this winter could mean the end of free access to these crucial drugs in 2023.
It's pretty amazing that I believe over 8 million Americans have received Paxlovid at no cost.
With the government picking up the tab. They're available under an emergency use authorization, but there's growing pressure to end the COVID health declarations. And when the cost is shifted to private insurers and patients with copays, Fendrick says use will go down.
I fall back on my mother's great quote who said, "I can't believe you had to spend $1 million to show that if you make people pay more for something, they'll buy less of it."
And less use could mean more hospitalizations, particularly among the underserved and chronically ill.
We basically are penny wise and pound foolish.
That's Dr. Michael Greiner, an assistant professor of management at Oakland University School of Business. He says the $530 course the government pays for Paxlovid is small when you look at the big picture.
People go into the hospital as a result of COVID, which of course is that's a direct cost.
But then there are indirect costs like lost productivity and people hit hard by COVID or long COVID dropping out of the workforce. Greiner says keeping antivirals and vaccines free should be a clear choice.
Versus not spending that money and then them potentially going into the hospital and missing a bunch of work. The trade-off there really should be a no-brainer.
And while private insurance may pick up a piece of the cost, some of those most at risk for severe outcomes are also among those most sensitive to price changes or seemingly small copays, especially at a time of rising inflation. So why is all this coming to an end? Well, according to the Kaiser Family Foundation, there are two drivers here. One, the government purchased supply of medication is running out, and Congress has been unwilling to allocate more money. And the public health emergency declarations that give the government added power to fight COVID, well, they expire every 90 days. And there are growing calls for those protections to go away. Keenan Smith, 7 Action News.